Good afternoon, everyone. First of all, before I start, I think I still need to apologize for the late starting. I don't want people to think it is an habitual, but this is beyond us. This is due to circumstances beyond our own control. Sometimes when responsibility calls, you need to actually act as fast as possible. So that would result to these delays. On behalf of the director and the staff of Kunda, my humble behalf, my sincere apologies for those who have already been here since 9 o'clock this morning for a late start. First of all, I need to thank God Almighty for the life that He has given me, for my family, my kids, my husband, my senior management of the facility, staff of Kunda, well-wishers, who without them, this program would have not been successful. I really acknowledge your time, your effort, that you all have strived sleepless night to make sure this event is successful today. Thank you very much. On the I table, I'll start on the extremely right. Dr. Hadi Tunkaraba, Madam, you are welcome. Next to Mrs. Ba, can we please give a round of applause as I'm calling their names, please? We have Uncle Seni from the council. Sir, you are welcome. Mr. Seni Sani, who is representing the Deputy Director for Planning, you are welcome, sir. Uncle Alfred Seni, I call him my uncle, I know the reason behind that. Sir, you are welcome too. Mr. Seth Kebe, you are welcome. Auntie Alimatu for NACP, you are welcome. And my honorable chairman, who always works tirelessly at any time I knock at his door, Mr. Ndao, there is nothing to say, Daddy, but thank you very much and you're welcome. Thank you, everyone. This has been an annual event. An event that we all sit here to showcase what we have done at the facility level. We are not here to find fault from each other, but to build each other. Please, I'm urging each and every one of you, when there is time for presentation, let's learn from each other, share ideas. That is the main purpose, so that next time when we come here, perfection will be ascertained. So please, let's go through the presentation because data is very, very important. If you look at our theme for this year, we said a positive data is the key to health development. So it's very important. We are all seated here today. Without data, I don't think we can able to tap fund from anywhere. So data plays an important role for health development. So please, your input, our output, your input, together will have a better outcome out of this event. And also, I'll be very biased. Our women CAFO is there, our women leader, please, Ma, you are welcome. Our police representative, you are welcome. All protocol duly observed. I can't recall everybody, please. You are really highly welcome to this auspicious occasion. As I said, this award this year, we do it in a threefold. On Wednesday, we had a match pass, a health walk. What do we want to do? What do we intend to achieve at that? You know, we have the NCD's clinic. Every Wednesday, these old people, they're coming to the facility. We are telling them that it's not only medication can make you well, you need to exercise. So we exercise along with them. At least they'll feel motivated that we care for their health. So we are led by the police band. We walk from the hospital up to the mosque, where we have a short briefing with the Al-Kalo, and then the Imam, then we move back to the facility. So that is a bravo for us at least. also engage what we call community participation. We go to the community, give them the service they need to have at the facility level. Try to encourage, what are we trying to say? With the community together, we can develop our facility. So when you don't go out to the community, I definitely don't know what is in the facility. Then as I always said, when you want to achieve something, you need to go closer to it so that you can able to gain what you want. So we have to go to the community, make use of them, tell them what is actually the problem, and let them come on board to solve it. And that was done. And today is the final day, which is the data presentation, and also we have award to give to those who have worked tirelessly. Please, everybody have worked tirelessly. But in a race, you must have one to win. This is a race, and it's a highly competitive race. For those who will be awarded this year, I said a big bravo to you. For those who would not be awarded, please don't take it as a defeat, take it as a challenge. That next year, I will be called here. So please, I'm urging each and every staff seated here today, you have done your bit. Everybody, whatever small thing that you have done what you can. If you are not called up on here today, please take it as a challenge. For the next upcoming award, you will be surely called here. On that note, I don't want to bother you. And I don't want to bother you with too much of lengthy speech. I am just appealing. We have a whole day here today with you people. That I need to put it across. It's very important. We have a whole day because we have events to show, awards to come in on board, and then we have a dinner to serve. So on that note, I welcome you all and open this award ceremony. Thank you very much.
Very much, Madam OIC. That was a very wonderful opening ceremony and a very clear message sent out to the invitees as well as the staffs from Kunda Major Health Center. I just want to buttress on a few points that, as he said, we have already run against time. That is the nature of this year's event. It's an exceptional one. We have never done it this way. Making it a 3-day event started this year. And I think it was something very, very wonderful. Going out to the community, meeting them, making them feel that the institution that we feel we're walking in and that we felt belonged to us, it's actually not ours, but it is their own. So involving them doesn't only end at the facility level, but going to meet them at their own grounds, making them feel comfortable with us and taking the leadership role when it comes to decision making in the hospital. It's very important. This is why we have a very functional catchment area committee members. And having done that walk out with them, we did a screening and we provided some medications and some lab investigations for them. And this helped a lot because we had some that were unable to come to the hospital and they had issues that were supposed to be taken care of. But when we went to meet them on Thursday, after having the march pass on Wednesday, having enlightened them that we were going to see them on Thursday, the turnout was just wonderful. I think we were there from morning right up to 4 o'clock. We couldn't clear the queue. So that was a very big plus to the facility as well as the head of the facility. Like he mentioned, we're going to be here with you guys the entire day. I'm sure if the event had started earlier on, right now we would have been at the far end of the program. But then those are reasons that are beyond us. But we'd like you to be patient with us. I'm sure the sun is very hot and the environment is not very conducive. But we just have to do this for each other. We just have to do this for the Gambia. Without wasting much time, the next thing we have on the agenda was a keynote address that was supposed to be given by the Director Western One, but because he is not around, we're going to skip that for now. But anytime he joins us, we will work on that. Next, we will move on to presentation of data, which is going to be a little bit longer than expected. But I believe here against the break for the prayers, we should be able to have 2 units to present. The theme of this year's event is Accurate Data, a Pillar to Development in Health. So we will want all the participants here present and the invited guests to please give a listening ear to our presenters. It's a forum where I believe we're all here to learn. Even us that are coming up with our data, at our angle, we know we are not bringing something perfect. Why? Because if it were perfect, we would have kept it to ourselves. But we brought it here for people to go through it together with us. That way, in the long run, the mistakes that were being made last year, we believe would not happen this year. And inshallah, the ones that we will make this year will not repeat themselves. So together, as we pave the way, we're going to have a smooth presentation in the long run. So, Lamin, are we set? Those on the high table, I thank you very much for officially gracing this occasion. You can please have your seat. That way you can face the board to analyze the presentations that are going to be made by the various units of the facility. Thank you.
To invite the Regional Health Director, Mr. Musa Kamara, to give his remarks, which was highlighted by the OIC that due to unforeseen circumstances, he was not with us when we started the program. Mr. Kamara, you are highly welcome.
The officer in charge and staff of Kunda Major Health Center, the Director of Health Services or his representative, Director of Nursing and Midwifery, the R&D staff here present, facility staff, and their representatives from other sister health region, the National Assembly member of the area, ward councillors, media representatives, all directors and line managers here present or represented, the Gambia Police Force representative, the GID, that is Gambia Immigration Department representative, Gambia Fire and Rescue Services representative, members of the communities served, women group representatives, KMC representative, distinguished ladies and gentlemen, and all protocols duly and respectfully observed. Good afternoon to you all. First, we want to register our sincere apology for not being with you as the program started due to other official functions that kept us away from you. We are gathered here, Mr. Chairman, we are gathered here to grace the facility data presentation and award ceremony as part of efforts to ensure effective health service delivery and sustainable retention of health staff of the Ministry of Health. The Kunda Health Center is a major health center that provides healthcare services to a wider range of communities within its catchment area and beyond. Kunda has a total population of 313,505 with 18 midwives conducting an average of 15 deliveries per day, 250 per month, and 2,876 deliveries per year. This is an important achievement of the facility, which is Kunda, the only major health facility within the health region. Mr. Chairman, distinguished ladies and gentlemen, I want to register the successes and challenges of Kunda Major Health Center. The renovation work or renovation of fire-ravaged RAMCA, that is reproductive, maternal, neonatal, child, adolescents, and adolescent health services area or delivery unit that was ravaged by fire has currently been renovated through the National AIDS Secretariat, NAS. There is also strong collaboration between the facility and the partners such as Health Center Management Committee and the community of Kunda who are here present to grace the occasion. The MRC Gambia at London School of Hygiene and Tropical Medicine is another important partner of the health facility. In collaboration with the Regional Health Directorate through initial support from RBF, Resource-Based Financing, now the National Health Insurance Scheme, the authority, that is in NHIA, National Health Insurance Authority, gave a startup capital called subsidy for the development of the facility. 70% of this startup capital will go towards construction works and renovation works of the health facility. And 30% will be the staff bonus, which keeps the staff motivated. Other partners include Carnegie Municipal Council in the management of waste. Friends and donors of the health center in country and in the diaspora, who complement government efforts in strengthening the facility through the provision of essential medicine, equipment, and supplies. With the advent of the National Health Insurance Scheme, development initiatives of the facility and many other facilities within the health region will be sustainably managed. As a health region, we want to register our thanks and appreciation to MRC Gambia, NAS, that is the National AIDS Secretariat, individual donors, local and diaspora, Ministry of Health, and other stakeholders for contributing their quota to the structural transformation of Kunda Major Health Center, and while we are counting on others to also follow suit. The Ministry of Health has high expectation for health professionals and recognize their important role in health service delivery. Mr. Chairman, distinguished ladies and gentlemen, I would not conclude without giving some goodwill messages, which read as follows. One is, ensure you serve your population very well. Remember always, we are the service providers. It's like demand and supply. We are the suppliers of the services. The consumers of the services are the general population. So let's serve them well with the utmost knowledge and skills that have been inculcated into us from the various health training institutions. Always remember fulfilling your obligatory duties, because regulatory bodies will monitor your practice. You will bear with me that almost all the categories, with the exception of few, all the categories of health staff or health workforce of the Ministry of Health have regulatory authorities. One is Gambian Nurses and Midwives Council of the Gambia, Medical and Dental Council of the Gambia, the Pharmacy Council of the Gambia, and the Public and Environmental Council, Health Council of the Gambia. So these are the regulatory bodies, and the lab is in the making, laboratory is in the making. In the long run, we will also have the lab council. We would implore on all the staff to monitor and improve staff punctuality to work. This is very important, and those who are managers and unit heads, it is important that this is taken into consideration so that staff reporting to work on time and adequately and efficiently working would lead to better outcome, health outcome. When next you have your data presented, you will have less challenges. And so timely reporting of facility data to the Regional Health Directorate, where we have data managers, for the data to be punched or entered into the DHIS2 data platform. Promote annual data review. We want to implore on the management and staff of the health facility and many other health facilities to ensure that they promote annual data review, feedback and appraisal of staff. Like this one, we are imploring on you to ensure that this gets continued. And others should also emulate Kunda to ensure that this takes center stage at all times, because it keeps staff motivated. Motivation is not only giving money. Telling somebody who is working, thank you for your service, is enough testimony for acknowledging the individual's work. Monitor and encourage proper record keeping and archiving. This is important in as much as we are talking about data. In the absence of proper record keeping and archiving, the data will be compromised somehow. Some of the challenges will be there where you will find it difficult to attain your objectives as far as data management is concerned. All health professionals. In conclusion, Mr. Chairman, distinguished ladies and gentlemen, I want to remind all of us here that all health professionals are duty-bound to follow their strict code of ethics. And also remind you to be aware and practice the professional code of ethics for sustainable development. On that note, I thank you all for your kind attention.
But in the area of gender-based violence and social incidents. So my role here today is to present my data on GBV cases and social incidents that have been recorded at Kunda Major Health Center. Between the period of August 2023 to May 2024, the same venue. I'm a child of Kunda, so I've been born and raised in Kunda. It gives me real pleasure to be able to do something like this in the name of Kunda. So with that note, please. Okay. So between this short period, I would say, we've recorded cases of intimate partner violence. We've seen various cases, but we'll be taking it bit by bit as they're different. So we've seen 28 incidents of intimate partner violence, and out of that 28, 21 were female and 7 were male. And when we refer by their own partners. So when we talk about gender-based violence, please put this, in the front line. It does not only concern women or young girls. Men and younger boys are also affected. Thank you. And then this is something that is very common in our communities or in our various settlements. Conflict between co-wives or between co-wives. But very rare, people come out to get support for that. Getting professional aid, especially in terms of mediation, creates bonding, creates understanding. And through the unit, we are able to intervene in this case, and through mediation, collaboration was established within this household, and the co-wives have a better understanding with the support of their husband. And please note that all of these cases that we have recorded, we provide medical care for them and psychosocial support, which includes the mediation and other healthcare areas. And thank you. Okay, unfortunately, we recorded, I said unfortunately because as proud as I am standing here, I'm not proud to say these things because they're affecting our young ones. We recorded 2 attempted cases of rape. And please, hear me out loud. These are young girls, 2 years old. 2 years old, both of them, 2 years old. One of the cases was reported at Kunda police station, and I am blessed to say that we have a rep from the police station, and they have been very supportive through our case management. And the other one was actually brought in by a uniformed officer from Bundung police station to a health facility. Remember again, these are 2 years old girls or babies. Attempted rape. Saying that the rape did not even happen is attempted doesn't mean that the harm has not been there. This is why we provide not only medical care for them, but also psychosocial support for them. All right. And then we recorded one case of alleged rape. Usually we are fond of saying rape, that's for rape, that's for rape. But us as healthcare providers, it is not our duty to say it is rape or it's not rape. When we have cases, we record this as alleged rape till the prosecution or the prosecutors said it is rape, they confirm, then we can book in our records that it's rape. So far for this one, we record it as alleged rape. And she's a 24 years old young girl, and she was allegedly raped by a gang of boys, and unfortunately got pregnant. Yes. So the case had been reported at Bundung police station, and then she is receiving the necessary care at Brikama District Hospital through the support of the social worker at the one-stop center, whom I've been collaborating with. Again, unfortunately, we recorded 9 cases of child abuse. Again, I'm saying unfortunately, because these are affecting us all as a community. We had 6 cases of unplanned pregnancy. And these are young girls that got pregnant out of wedlock. None were raped, none were forced. It's just naiveness, and then things turn into something else that are beyond control. And then the youngest were 19 years old. We were 4 of them, and then the eldest were 21 years old. All of them have received medical care that involves the antenatal bookings at the various health facilities, because note, sometimes these young girls come from our own community, and sometimes due to privacy and confidentiality reasons, they choose to go to a different health facility for antenatal bookings. But with all that, I and the rest of the team work together with the other social workers that are in that jurisdiction. And then I am very proud to say that through mediation, we're able to help these girls, young girls, have a better communication with their parents and their guardians. Because usually when these kind of things happen, the first thing that we see that is the parents will send you out of the house. And through that, we're able to use the elders in various areas that will go, like back in the days, Also, creating room for peace and understanding in our communities. As I mentioned earlier, using community leaders in the relevant areas to create peace between the young ones and their parents and guardians. We see that as an achievement and peace building. Reuniting survivors with their loved ones, again, speaking the same language. Getting fully funded scholarship for survivors to gain life skills. And then we have also successfully started a support group for survivors. And this support group entails the young girls that have been either abused or that have been in some sort of trouble with their parents or with the community. And this support group is helping the young girls along with us also to identify their strengths and their weaknesses and also support each other in the various areas, which includes the education sector where they're getting the fully funded scholarships through. And the positive response of male survivors seeking for professional aid. Seeing the data, a 61-year-old man, a 52-year-old man walking into our facility telling us that Smajabat Moma do, Smajabat Moma Mata. To some it may be funny, right? But that is an achievement because it's very rare to happen. Some people think it's like, no, Poku do good. We are all entitled to this. It is our right to get it. So don't feel that you are a man, that because you are a man, you shouldn't go for it. No. We are all going through something either way, directly or indirectly. Please do take note. Having a positive work relationship with other service providers, not only with my colleagues at Kunda Major Health Center. All I can say is just thank you for your endless support, but also other service providers in the various sectors either being in health, social workers, and the educational areas also. Sorry, this last one is very, very important. I am proud to say that with collaboration and positive networking, I'm able to get a better connection with the Ministry of Basic and Secondary Education and other stakeholders in the areas of providing available support for survivors. So when we come to the constraints, this here will be very helpful in many ways. So some of our constraints in case management include lack of adequate GBV case management case management case workers. Prior to Ramatullah being trained, I had been the only case worker at Kunda Major Health Center. That does not mean the rest of the staff were not doing the work or are still not doing the work. They are still doing the work. But getting the relevant training in GBV case management, and Halima, you are here. We know the difference, right? Prior to train and post-training, we know the difference. So it's very, very important that we already have dedicated staffs. So getting them trained in GBV case management is very vital. Late reporting of GBV cases for timely intervention, especially when it comes to alleged rape cases. When people are raped, especially the younger girls that can conceive, rape reporting usually results into unplanned or unwanted pregnancy. So having these young girls report to the facilities or the nearest police station as soon as possible will help prevent that. The health personnel are here, giving the emergency contraceptives, screening for other infections, HIV/AIDS, hepatitis. But because of the late reporting, we have been having so many challenges in areas of that. Lack of access to the GBV, Gender Management Information System, that is the GMIS platform. Anyone who is affiliated with Network Against Gender-Based Violence or UNFPA, we have a system in place. We have the one-stop centers in various health facilities, and they are using the GMIS platform, whereby cases seen at their one-stop centers are recorded through the system. And anywhere you are, when the case is reported, you don't have to use paper, you don't have to struggle with so many things. You can have access